Amazing evening. Getting ready for this month's Blessed Family live stream. Amazing evening. As anyone join us, we'll be waiting. Please, if you're online, can you just share a comment in the chat, please, so that we know you are, and let's know where you are connecting us from. Thank you very much for connecting us tonight. We are all expectant. If you are joining us, let's know, are you connecting us from Facebook? Thank you, Mrs. Adelaja, from where? I think from Nigeria. Thank you for connecting us tonight. I believe you have your questions ready. The doctor is already in the house. Okay. Sorry, if you are connecting us from Facebook, YouTube, can we see that in the chat? Thank you very much for connecting us tonight from Ogun State, Nigeria, Mrs. Adelaja. You are welcome. We'll start in few minutes' time. Thank you for connecting us tonight. Please, if you're online, let's know where you're connecting us from. Thank you for connecting us tonight. It's going to be wonderful, impactful, educative, and informative. Please, if you are joining us, please, let's see where you are connecting us from in the chat, please. We'll start in few minutes' time. So, all right, good evening, everyone. You're welcome once again to another, Daddy Olayinka Kayode. Good evening, sir. Thank you for connecting us from Birmingham, United Kingdom. It's another wonderful time of Blessed Family live stream. We do this once in a month, bringing different topics, different guests to bless us. And tonight we are talking about women's health. Our guest is already in the house. I will bring her on board now. But let me just, Dr. Durowade is a friend of the house, as you all know. She's been with us a few times, and she was with us during the last Blessed Family event, and we were blessed. And people have been asking, okay, Sister Gbemisola, thank you for connecting us tonight. Thank you very much. We were actually blessed during the last Blessed Family event in April, and people have been asking that we should bring her back. We should bring her, and we didn't have enough time to deal with all the questions then. So today we are talking about women's health, dealing with some of the questions that she was not able to answer. And you know, one of the main goals of Dr. Durowade is to advance women's health, and then to make knowledge that is supposed to be common to be common. I think one of our, will I say, our slang is making common knowledge that is not made common to be common. You know, knowledge that is supposed to be common to every one of us, but it's not common. But our goal is to make those knowledge common to us and to advance women's health. I will bring her on board now so that we won't waste time. Okay, I'll bring Dr. Durowade. Okay, thank you very much, doctor. Thank you. We appreciate you. We appreciate your time. Doctor is a very busy person. She has a private practice in US. We appreciate your coming to Blessed Family Ministry again, blessing us tonight and with free consultation. We do appreciate that. And after this, when if you consult doctor after this, you're going to pay. But today is free consultation. So be ready with all your questions. Thank you so much, doctor. We
Thank you, Ma.
appreciate you. And then, like I said, today is question and answers on women's health, and starting from where we stopped during the last Blessed Family event. So we'll start right away while people are connecting us. If you already connected us, please share this link to others. Let them come and be blessed. It's going to be educative, it's going to be impactful and informative tonight. So during the last time that Dr. Durowade discussed women's health with us, she explained certain areas of women's health. Number one is preventive health. And in that preventive health, she did mention about doing some tests, pap smear test, mammogram, colonoscopy, and bone scan. Now, one of the things I want to take doctor is, pap smear is very common, yes. But we have discovered that pap smear cannot discover ovarian cancer. There are two types of cancer: cervical cancer, ovarian cancer in women. And we'll be asked to do routine test of pap smear every now and then. But recently, I myself learned that pap smear cannot detect ovarian cancer. So what kind of test can a woman do? How can you prevent that? Can we start with that, doctor? Please, we would like you to introduce yourself briefly, please. Thank you.
Good evening, Ma. Thank you for having me again at the Blessed Family platform. Thank you, everybody, for joining. I appreciate the honor. Thank you for always thinking of me when you think of your women's health questions. Like you said, the goal of my practice is to make uncommon knowledge common. So
That's
things that should be common knowledge, but they're uncommon, I'm making them common. So I love educating women about their health and things that they should know. And I'm surprised every time I talk to women how much they do not know. So my name is Dr. Taiwo Durowade. I'm an OBGYN. I'm a physician. I have a private practice in the United States, like Mommy said, focusing just on women's health. So I do pregnancy, but only first trimester. Majorly, I'm focusing on women outside of pregnancy, what's going on in their lives, how they are taking care of their health, all the things that come up as they get older: menopause, periods, fertility, sexual health, things outside of pregnancy that has to do with women is what I take care of. And so I see a lot of women every day and get to learn about what they're experiencing, what they know and what they don't know, and I do my best to guide them in the right direction. So, according to Mom's question, when a woman comes for her women's healthcare visit, we do kind of full body. So, a lot of people have a primary doctor, a GP, like you say in the UK. And the GP may not necessarily be hyper focused on women's health, which is why probably when something comes up with the GP, they send you to a specialist who is the gynecologist. That's where I come in. Now, for women's health, we do breast health. So I'll do a breast exam during that health visit. I always ask about abdominal, bowel movements, if there's blood in the stool, important details like that. Appetite, weight gain, those things are very important. And then we go to the pelvic exam. I also do a thyroid exam as well. A lot of people don't recognize that the thyroid is important. So I do thyroid, breast,
that's
belly, pelvic. So that's how I describe to the woman what's going to happen during her exam. She's going to get a thyroid exam, a breast exam, a belly exam, and a pelvic exam. So we go from top down.
that's
Now,
true.
thyroid exam, we just feel and make sure that the thyroid is not enlarged. And then breast exam, we do a breast exam. I advise the woman how to do a breast exam, what to be feeling for. And then the belly exam is the abdominal exam. The pelvic exam basically allows me to examine the outside and then the inside. Inside, when I take a look inside, I see the cervix. The cervix is where we get a pap smear from.
Mm.
So it's a vulva exam, that's examination of the outside. A vaginal exam, that's an examination of the inside. And then while I'm examining the inside, I visualize the cervix. The cervix is that part of the uterus that's inside the vagina. So that's the part that would dilate when a baby is coming through, and after a baby's done, it goes back to normal size. It looks like a circle. On that cervixes, we use a brush to get a pap smear. Pap
Mm.
smear is trying to tell me information about the cervix. Are the cells on the cervix normal? Do they look normal? Are they starting to look abnormal? And so basically, the Well Woman exam allows me to get information about thyroid health, breast health, colon health, that's bowels, and vaginal health. And vaginal health is where we get the pap smear from. After the pap smear, I always do an internal exam with my fingers and feel the uterus and ovaries. So
Okay.
we call that a digital exam. So it's different from a pap smear because a pap smear is getting cells from the cervix, different from
Okay.
a external exam or vaginal exam. This is now a digital exam where I feel. If I feel fullness on the sides, the uterus is in the center, the ovaries are on the sides, right and left. So I do what we call a digital exam to feel for the ovaries. Is the uterus enlarged? Are the ovaries enlarged? So mommy said that a pap smear does not detect ovary cancer. That is correct. A pap smear is only looking at the cervix
Mm.
for cervix cancer. The
Mm.
reason we do preventative tests is because we want to know that this test will give me information that will save this woman.
Mm.
If the test is not going to give me information that will help me detect things early that will save this woman, then the test is not an adequate screening test because I can still miss things.
Mm.
So the pap smear allows me to check if there's cervix cancer because then I can catch it early and prevent it from happening. The breast exam mammogram allows me to detect breast cancer early so I can catch it and prevent it from becoming untreatable, stage 4, things like that. The colonoscopy, like when we mentioned, allows me to check the colon, make sure there are no signs of colon cancer. If they are, we can catch it early, prevent it from progressing and becoming stage 4. So that's what those tests are meant to do, give us information that will save this patient or this woman. Now,
Okay.
we don't have one for ovaries. Even if we do an ultrasound, ovary cancer does not show up with signs until it's stage 4. So
Mm.
by the time women are having symptoms of ovary cancer, they have loss of appetite, they have an enlarging abdomen, the abdomen is just growing bigger and they they are not like putting weight on anywhere else. It's just the belly that's enlarging
Mm-hmm.
and they're losing weight. So if a woman came to me, talked about, loss of appetite, weight loss that she's not planning, she's not like she's dieting, and an enlarged abdomen, like her belly is full of water, that's a very sick woman that is most likely dealing with stage 4 ovary cancer. The
Wow.
best way we have to check for this is that digital exam I talked about at your Well Woman. If the ovary is feeling heavy in the pelvis, we'll get an ultrasound or we'll get an MRI or we'll get a test that can help us see the ovaries.
Okay.
What, but like I said, the signs don't show up until it's advanced. So
Okay,
what
doctor, sorry. Talking about preventive measure, how can a woman take some preventive measure not to have ovarian cancer? What will you advise since pap smear cannot detect ovarian cancer?
Right. So we don't have that test, that ultrasound test or MRI or CT scan test that can help us find ovary cancer early. So what I do when I ask my patients is, okay, is there anybody in the family with breast cancer, ovary cancer, or colon cancer? I ask those specific ones because I know those ones can run together in the family.
Okay, okay,
And so if there is a family history of that, then I tell the woman, okay, we probably need to do genetic check on you, see if
okay,
there's a genetic risk higher than the regular population for that woman to have ovary cancer. If
okay.
there's a family member that has ovary cancer, we tell that woman, and that person is still living, we tell that woman to go and get genetic testing done. If the genetic testing shows that there's an increase of ovary cancer, those women get their ovaries removed.
Okay.
Most people, they don't know if their family members have ovary cancer, or they say the person died of cancer, but they don't know what kind of cancer the person
Hmm.
died from. So
Hmm.
a lot of it is people don't know their family history or people don't talk about it. People don't share that this is what's going on in the family. And so the best we have right now is genetic testing, genetic counseling. And if the genetic test is positive, then the woman gets her ovaries removed.
Sorry, doctor, before we, because I want us to go to other things, but there's a question that comes to my mind now about this ovarian cancer, cervical cancer. Would you say hysterectomy is that the right pronunciation? Would you say it can prevent ovarian and cervical cancer if a woman
Uh,
has done hysterectomy? Can he
it's,
prevent it?
so hysterectomy is when we remove the uterus.
Okay.
When we remove the ovaries, it's called oophorectomy, meaning removing the ovaries. We do not recommend removal of the ovaries in a woman younger than 50.
No, for those that are over 50, is
For
it
those that are
possible?
over 50,
Yes.
you want to the only thing we can do to prevent ovary cancer in those women is to remove the fallopian tubes.
All right.
They found that the ovary cancer in most women starts from the fallopian tubes. So if this woman is having a hysterectomy for heavy periods or abnormal paps, something to remove the uterus for. We remove the uterus, we remove the fallopian tubes, but we save the ovaries if the ovaries look normal. This
Okay.
is why the ovaries make estrogen. Estrogen protects the heart, the bones, the brain, which is why when menopause happens, women start having problems with their hearts, their bones, their brain.
Okay.
And so we try to preserve the ovaries as much as possible, only in women who have a family history of ovary cancer. And we've checked them and they are at increased risk of ovary cancer. Will we remove their ovaries because nobody, you will take menopause over ovary cancer, right?
Okay.
So we would remove the ovaries in such a situation. But an otherwise healthy woman, no family history, no genetic test, it is not recommended to remove our ovaries at all because it makes estrogen that is has other benefits outside of that.
Doctor, I would like to ask one or two questions before we go to the question from our audience today. Since talking about preventive health, you did mention about colonoscopy and then bone scan. In fact,
Yes.
it was the first time I will be hearing bone scan, that we need to do bone scan. And you did mention that for those with age 65, and then the colonoscopy age 45. Can you just a word or two
Yeah.
educating us on these two types of tests as
Absolutely.
part of preventive measure?
Absolutely. So colonoscopy is when they scope means camera.
Okay.
Colon means the colon, the bowels. So they
Okay.
put a camera inside the colon to make sure that the colon is clear. There are no polyps, there are no lesions, there are nothing budding, nothing starting. If they are, they remove it and test it.
Mm.
If it's positive for a precancerous lesion, they start watching that person maybe with another colonoscopy in 2 years or another colonoscopy in 3 years. Now, as I said before, screening tests are tests that are designed to help us save somebody. If
Yes.
I can use this test to find information that will save this woman, then it's an adequate screening test. So, colonoscopy allows us to catch colon cancer early and
Mm.
prevent it from happening in someone or prevent it from becoming stage 4.
Mm.
We were finding that in Black people, they were
Yes.
showing up at age 49. Initially, the age for that colonoscopy was 50. So when I was in
Okay.
training 10, 15 years ago, they would say colonoscopy starts at 50. But
Okay.
people were showing up at age 39, 45, 49 with stage 4 colon cancer. And so
Mm.
now they moved, especially in the Black population, so they moved that age now back to 45 so
Wow.
that we can catch it early if it's there. And I've had a few people, not a few people, a good amount of people that their colonoscopy found a polyp. When they
Mm.
tested the polyp, it was a precancerous polyp. If
Mm-hmm.
nobody had seen that polyp in 10 years, they will have had stage 3 colon cancer.
Wow.
So those tests are really significant. Now, some people are afraid of anesthesia, going to sleep, getting sedated. So there's a kit called Cologuard. Cologuard, basically, your doctor write a prescription. The company will ship the kit to you. They'll teach you how to collect a stool sample. You send the stool sample back to the lab. The lab will check that stool for cancer DNA because cancer
Mm-hmm.
cells do shed. If there's cancer DNA, then you do have to go and do the colonoscopy. If there's no cancer DNA, then you're free. There's no nothing. We do that every 3 years. Colonoscopy, if it's normal, it's every 10 years.
Okay. Okay. What about bone scan?
Yes, ma'am. The bone scan is to check for signs of weakened bones. Now, a lot of people say, oh, we're African, we have strong bones. We do find weakened bones in African American women as well. And weakened bones prevent you from being able to move. You might start having to walk with a cane,
Yeah.
wheelchair,
Mm.
and it reduces your quality of life. And those women do end up passing in their early 70s and stuff like that because they're not moving around, you know. And so bone scan is for women 65 and up when we know that they don't have estrogen anymore. We know that their
All right.
estrogen production is less than 10%. So
Okay.
those women are at increased risk of weakened bones. So we put them on extra calcium, we put them on extra vitamin D to build, and we tell them to do exercises to build strong bones so they don't become invalid, basically.
So it's for older women, if I get you right.
It's for older women. Now, if somebody is on medication that we know is reducing their estrogen, or somebody is a smoker,
Okay.
or somebody is on steroids, chronic steroids, maybe they have an inflammation in their body and they've been on steroid for 20 years, that will weaken their bones. So
All
those
right.
are indications to do it sooner than age
That
65.
is 65. Okay. Now, I want us to go to one of the main question of the day. Why do women lose interest in sex?
Mm,
Because I listened to your previous message in that, and I had a lot of so many reasons which we women need to. Why do women at certain say for one reason or the other lose interest in sex? Can you just talk about, please, if you have questions, put it in the chat. Doctor is here to answer questions on women's health tonight. Just put it in the chat. We just have this one sent to us earlier, so we want to talk about it briefly. So why do
absolutely.
women lose interest in just in sex, please?
For women, sexual activity or sexual life starts with her in the mind. So it's she's in a good relationship. In her mind, she feels safe and connected to this person. Also, she doesn't have a lot of burdens on her mind, and she's healthy. So women who are losing interest in sex, the first question I ask them is, "What's your life like?" And they'll say, "Well, I have 3 children. They have school activities. I'm at work 9 to 5. After that, I have to go home and cook. After that, then I have to do their homework. Then I have to clean the house. By the time it's nighttime, I don't have any energy. I'm not even interested." And so there's a lot of
That's
demand.
sad. Mm.
There's a lot of demand on the woman's
Mm.
mental status, is what I mean. So she's using a lot of her energy throughout the day and when she's at home. So one of the hormones that we actually need for that is called testosterone.
Mm.
Now, as a woman gets busy and busy and busy and increased stress, testosterone goes down. Testosterone. Now, the body will maintain estrogen as much as possible because the body, nature wants to preserve fertility. So as she'll still be having periods, but she'll become deficient in the hormone called testosterone.
Mm.
Those women are very, very burdened. That's the question. That's the term that I tend to hear from them, that there's just a lot going on. I have so much going on in my life. I have so much going on in my life. Or they don't have a lot of help. They feel like they're not well supported. And so sex is the last thing on their minds. They're like, I have to pay my bills. I have to work 2 jobs. I have to take care of my children. Sex is the last thing on their minds. So, and it's mostly because as there's more burden in their lives, this hormone testosterone declines.
Mm.
So most women that come to me and that's their only complaints, the first thing I tell them is, I know I cannot do anything about the fact that you need to work 2 jobs, right? I cannot do anything about the fact that you have kids to take care of. What I can do something about is I can increase your testosterone level to help you cope with all these demands on your life. And so most times when I check that testosterone, it's like 10 or less than 3, 5, when you need your testosterone to be 60 and above.
Wow.
So usually will replace testosterone in these women. Either I give them a cream, or I give them an injection, or I give them an insertion. There are three ways to give that testosterone. And I find that as those levels go up, they
Mhm.
have it's like their energy is increased. It's like they have more room for all the things that are going on in their lives. So they are not exhausted at the end of the day. Their brain is still working when after the end of the day when they want to help their children with their homework. They don't feel overwhelmed with all the demands of their lives, and there is interest in sex at the end of the day.
Okay.
That is
Okay.
what I have found to make the biggest difference, because I cannot help them with their bills. I cannot change their lifestyle. I
Mm.
cannot change the demands that are on their lives. If I tell them to get a personal assistant, that's money that they they don't have. It's not everybody that has that luxury. So what I can make a difference with is the hormone level. Since I know that these demands are dropping the hormone, let me bring the hormone back to help them manage the demands and help them with their sexual
Okay,
desires.
I'm taking you on that. So you are saying if you increase the hormone level, it could help them, it could help their sex drive.
It
But I
raises
remember,
it up dramatically.
okay, but I remember you said something about apart from hormone, there's need for counseling. In that
Mm,
your
yes,
that
ma.
I can be giving you hormones. If there are other factors, it might not work. So will you say
Absolutely.
something about that, please?
Very, very. The women that I have had difficulty getting that result, let's say I give them testosterone, I give them all this thing, and they're coming back still telling me that it's not working. We always have to go back to what's your relationship with your partner? Are you in a safe relationship? Do you feel connected with your partner? Do you feel
That's
safe
it.
with your partner? Do you
That's
feel
it.
supported by your partner? Do you feel like this is the right person for you? So you're right, Ma. Ideally, though, that testosterone alone, even without that, will increase sexual desire.
Okay.
Even if somebody is not feeling supported by their partner, unless it's really an abusive relationship, then there's nothing the hormone will do. But most of the time, the testosterone, my patients describe it as a feel good hormone. It makes them feel good
Okay.
about life, makes them optimistic, makes them like things that used to annoy them, they just won't get annoyed anymore. Then the people that used to consider their partners annoying, they say their husband is irritating them, he's doing things that are annoying them. Suddenly, it
Whoa.
doesn't bother them anymore. What little things that the children will do that they find that it irritates them doesn't irritate them anymore. They just have a calm mood. That's what they call that
Sorry.
testosterone hormone.
Is this experience, will you say it's with older women or younger women? Because I'm surprised if you say hormone could stop, could increase, could help your sex drive. Is it with older women? Because I'm coming to the issue of older women and the
Mhm.
younger ones. Are you saying
Everybody,
that giving hormone to women can improve their sex drive?
everybody. I have women as young as 38, 39 getting testosterone because the
Mm,
same factors are dropping their testosterone. They have an overwhelming life. They
mm,
have a busy life, busy household, busy children. And in America, or in the Western world, you have to work to pay the bills. If you don't work, you don't get the paycheck, the bills don't stop. So everybody's kind of under the same type of stress. Most people are married in relationships, but they are too busy to care about that part of their lives. Testosterone brings that part of their lives back to the front
wow.
while also helping them manage the stress.
Okay.
So if the testosterone helps you to have energy, helps you to sleep better, helps you to be in a better mood, and also helps you to have sexual relations with your partner, you find you're a happier woman. They're just happier women. They come in
You, did you call it
overwhelmed,
happy hormone?
dejected,
I
and
think
as
women
young
use that.
as their 30s. I have women as young as their 30s
Wow.
so the women who need it every 3 months, maybe. Let's say the younger ones get the hormones, maybe last the bottle, if it's a cream, lasts them 6 months. My older patients, it will last them a little less, maybe 2, 3 months, because they need more of it. Their body is not making it as much. The
So
younger ones
there's
just need support.
so there is solution to helping our sex drive. Women, I
Absolutely.
believe you are hearing that. And I
Absolutely.
want to take you again to the issue of, because me, I've reached menopause and I know the experience I've had. Now
Mm.
I listened to your message again, and you said one of the symptoms of menopause is women being confused,
Oh,
anxiety, depression.
yes.
And you did discuss that the men should understand that stage of a woman's life.
Absolutely.
The same thing, men go through andropause. In fact,
Correct.
this is not even about women alone. We should also talk about what men go through too. So
Mhm.
at that stage, you said there's confusion. So are you saying is one of the symptoms of menopause for women? If you are confused, you find out that you are confused. I want you to say one or two things about
Yeah,
that.
absolutely. A lot of people think menopause is just hot flashes,
Mm,
sweating, and the classic symptoms that describe menopause.
yes,
But there are
yes.
some people that come to me and they can't focus.
Mhm.
They can't remember things.
Wow.
When they walk into a room, they're in the middle of a conversation and they forget what they're saying. They are holding a meeting and they cannot remember anything that they prepared for the meeting. Or they find that suddenly they can't sleep. There's just panic, sudden anxiety, things that they never experienced before. Some women have been to the cardiologist because their heart is beating so fast, they're having
Wow.
palpitations.
Mhm.
Some women have been to the psychiatrist because they're now depressed, just Nothing can improve their mood. They can't get out of. They're not motivated. They're just feeling down all the time.
Mm, mm.
One of my patients, I told you last time I was on here, she was admitted to the psych ward. She was
Wow.
so depressed, so overwhelmed, and it was dramatic how the thing is, all these different specialists don't put it together. They
Mm,
don't put palpitations together with sleep disturbance, together with hot flashes, together with low sex drive, together as under one umbrella of menopause. If you go to a psychiatrist, they will treat you for your depression.
mm.
If you go to a cardiologist, they will treat your palpitations. But nobody is putting it all under one umbrella of menopause. And so
Wow.
when they come to me, I'm telling, first thing I'm asking is, okay, hot flashes, are you sweating? Do you have trouble sleeping? Do you have trouble concentrating? Are you losing your train of thought? Do you have low energy, hard to be motivated? Do you feel down? Are you getting angry easily with your family members? Do you find that your children are getting on your nerves? Your husband is irritating you? That, and then when you think about it later, you're like, that I didn't really need to be upset about that. That was a very small thing. Those things together under one umbrella show me that you're hormone deficient. Most
Wow.
likely estrogen, most likely testosterone. People get confused when they are still having periods. They're like, but I'm still having my periods. So there's no way it's menopause. Something else is wrong. It is hormone deficiency. Menopause is not one thing that happens one day, it's gradual. It can
Exactly.
take 10 years, it can take 14 years. So you're gradually losing hormones, gradually losing eggs in the ovaries. The
Oh
ovaries
my
don't just
God.
suddenly one day pack up. They lose eggs, so hormone declines, and you start having those, and they can last 10, 15 years.
Wow.
10,
Oh,
15 years. And so women can, they're waiting for the hot flashes to say they're now in menopause. It can be happening
wow.
way before then. You know how they say as people get older, they get more grumpy, they get
Mhm.
angrier. It's hormone deficiency.
Oh my God. Oh my, this is highly informative. Now, because there are so many questions in the chat now, but there's something, like I said, I've listened to that your previous video over and over again. And you said in your private practice you do vaginal laser rejuvenation, which
Mm,
is tightening of the vagina. But Anna, is that the same thing with the same thing with vaginal dryness? If you
mm,
are saying the vaginal laser rejuvenation is to tighten the vagina, is it same thing with solving the problem of
of
vaginal
dryness.
dryness in
Mm.
women? Is it same
So,
thing?
so part of the signs of menopause as well, loss of estrogen, is vaginal dryness. The vagina is not making as much moisture. Sex becomes painful. It can even cause bruising and tearing. Now, there are different tiers of treatment. Some people will use a lubricant to help moisturize so that they don't have pain during sex. Some people will use estrogen. I use vaginal estrogen very liberally. Vaginal estrogen has been well studied, does not cause cancer, does not bring back cancer. New studies show that it does not bring back cancer. Even in women who have had breast cancer before, you
Sorry,
can
say that again, doctor. Did that
vaginal estrogen.
okay, vaginal estrogen.
Vaginal estrogen. I
Okay.
use vaginal estrogen liberally, like I said. At least the one that goes inside the vagina, we have studied it a lot. We know that we found that it does not cause cancer and it
Hmm,
does not bring back cancer in women who have had cancer before.
that's
This is for
true.
vaginal estrogen. Please don't mix it up with estrogen tablets or estrogen
All
patches.
right,
That's
all right.
different.
They
We're
are
talking
different.
about local treatment of the vagina for vaginal dryness. This is for women who have pain with sex, bleeding with sex. It feels, some people will say it feels like sandpaper, like it's just not pleasurable at all. And so it makes them even avoid it with their partners. So there are three tiers that I tell my patients about. The first one is lubricant. So when you want to be sexually active, then you go grab a lubricant
That's
to
true.
help. The
Okay.
second one I do is vaginal estrogen, like I talked about. The third one is vaginal rejuvenation. Now, the general term for vaginal rejuvenation is tightening, but what it actually does, it's repairing. It
Okay.
is repairing the tissue in the vagina, allowing the body to, it's like you're creating a little bit of what we call microscopic injuries. Then the
Mm.
body will now say, oh, there's an injury, let me go fix that. Just like if you have a cut on your hand, the body will send things there that will repair that cut, stop the bleeding, and make a new stronger tissue. That's what we're trying to do in the vagina.
Doctor, sorry, is it same thing with loose vagina? Sorry, there's some women after
Right.
giving birth. Is it
After
is
giving
it
birth.
is it same
Right.
thing?
So that's where I'm going. So the repair causes collagen to come into the vagina. When there's collagen, there's stronger tissue. So that laxity, that looseness becomes more toned. That's what the collagen does. The repair also brings new glands. those glands in the vagina now make moisture. So you don't need to grab a lubricant again. You don't need to grab
Mm.
estrogen again. The vagina now has new glands that are making moisture. The
Okay.
next thing is that it gives you new nerve endings, so more sensation. Women actually describe increased sexual pleasure after doing the laser because there's more moisture, more tone, and more sensation. So that's the advantage of the laser over a lubricant or vaginal
Okay.
estrogen.
Okay.
Vaginal estrogen will help to repair the bruising and the thinness that is happening. So as women get older and they lose estrogen, it becomes thin in the vagina, easily bruised, easily traumatized. Estrogen
Okay.
helps to prevent that one. So, but it doesn't increase sensation and it doesn't increase tone.
Okay.
So that's what the laser would do. That's the advantage that makes the laser the most expensive because brings tone, brings collagen. They call it tightening because of that tone. The
Okay.
tone is where that tightening comes in. So it's not necessarily going to make the vagina narrower or anything. It just brings more tone in the tissue inside so that it doesn't feel loose.
You know, as what is coming to my mind is, are all these services available everywhere? Because
Everywhere.
you are in US, you have a it's a private practice in US.
Yeah.
Are they all available
I,
all over?
there
How
should
do we get
be.
that if
There
I'm not in
should
US?
be.
Mm.
Now, there should be places in the UK that do it. It's just you might have to pay a price for it.
Okay, and then some
Now,
private hospitals in Nigeria. Is it possible for those in Nigeria?
great question. I haven't looked in Nigeria actually. But let's say you cannot get the laser. Vaginal estrogen should be available by prescription from your doctor.
Oh, that's true.
Vaginal estrogen will help with dryness, will help with bruising, will help with even women who feel like they have to pee all the time. Now there's a symptom people don't add to
Mm.
menopause. It's
Mm.
called urinary urgency,
Wow.
where before you leave the house, you have to pee. When you get to where you're going, you go to the
Ah,
bathroom to pee.
wow.
In the before you some people don't travel far because they have to use the bathroom every time. That's loss of estrogen in the vagina. The bladder also requires estrogen. And so these women, once I give them estrogen, it's like it's like turn around. The bladder is no longer controlling their lives.
My God, this
Yeah.
is how do I say, mind blowing, because what you just said now is something I can even relate to. I'm
Yeah.
telling you, going to the
A
toilet
lot
and
of women.
you wouldn't
Yep.
even know it's because of lack of
Of
estrogen.
black. Yeah.
I
People say,
should
oh,
go
I
to
drink a
my
lot of water. Oh, my bladder is weak. I hear things like, oh, my bladder is weak. No. The
So there's solution to that.
vaginal estrogen.
See, I'm just wow. Okay.
There's another one. There's another one.
Knowledge is
So
power.
sometimes people will have they eat a lot of lemons,
Uh-huh.
oranges.
Uh-huh.
And as Africans, there's a lot of tomato in our diet. So anything acidic,
Uh-huh.
citrusy,
Uh-huh.
will cause overactive bladder. So some people, let's say they're really, really afraid of estrogen. So I tell them, okay, what's in your diet? Is there anything acidic in your diet? Citrus, tomatoes, chocolates, caffeine, coffee,
I
all those
can't
things
believe.
cause, especially if you are in menopause and don't have the support of estrogen, then you have to cut out these things so that you can give your bladder a little bit of break.
My
But if you
God.
want to keep eating your tomatoes, vaginal estrogen is
And your
now,
oranges
and
and
your
everything.
oranges.
That's why I'm raising up my hand. Oh God. Ignorance is actually, will I say, disease.
I
And knowledge
know.
is power. Now we have some questions and time is ticking, doctor. Oh my God. And these questions, I have about five I've seen now. What I would just say is that please just maybe 1 minute, let's touch
Okay,
them
okay,
so that
okay.
at least we could cover as many, because doctor is not coming this year again. He's next year. So let's maximize today.
Mhm.
Now let me what are the side effects of
Testosterone. Now,
testosterone?
the testosterone we give women are by cream, injection, or pellets. So they're not going to get a deep voice. They're not going to start growing mustache or chin hair or anything like
Mm,
that. The doses for women are very mild. If I
okay.
give a man 2,000 milligrams of testosterone, a woman is getting 100 milligrams or 75 milligrams. So much, much less than what a man would be getting. So I basically do blood work and I watch their levels as I replace their testosterone. So
Oh,
most women don't have masculinization symptoms. There's no risk of cancer with testosterone. It's been around for 40 years. It has
okay.
not been shown to cause any cancer. It's not the same concern we have with estrogen. There's nobody who's not a good candidate. Some people, once they're over 60, we cannot give them estrogen So those
Mm.
they come to me and they have all these symptoms, and I'm like, because of your age, because of your history, some people they've had high blood pressure, they've had stroke before. I cannot give them estrogen by pills or by patch. I the only option I have for them is testosterone or a non-hormone medicine. But if they have symptoms of low sex drive, there's no non-hormone medicine that's going to help their sex drive. Testosterone is the only one.
I
So
think I think I'm going to visit this your practice in US.
yes, I would love to see you.
Honestly, I need all this. Apart from
No,
online, I need to be
honestly,
there.
honestly, I feel like when they come, when my patients come, they get a turnaround, and that's honestly been very. That's what's been fulfilling for me as a provider is that I can fix all these things with just two things, two, three things, and you
Wonderful.
become a happier, healthier, more joyful,
Yes, and your life is much
vibrant
better, and your
woman.
marriage is sweeter.
Marriage is
There
sweet.
was a time I did a kind of a seminar on how hormonal imbalance can destroy your marriage.
Absolutely,
It's true. So many
absolutely.
people have, this issue of loose vagina. I've seen a woman whose husband left her because of loose vagina. And you can imagine there are solutions to it,
They
things
are.
that should not separate us. The
Yeah,
woman,
yeah,
so a lot of,
and
okay, let's go
yeah.
to our please. Like I said, maybe one minute because I have so many
Okay, ma.
questions here. And the one they sent to us, we've not even answered it.
I
What are the
I
causes
have
of,
ones in there that I want to answer, so
okay, okay,
we
can
can
I
go over
just,
this. We can go over these ones in the chat for now. But
okay.
there are two things in there that I do want to
Okay,
touch on.
what, please, what are the causes of early menopause? Can family planning be a cause of early menopause? Just one
No,
minute, doctor.
no, family planning does not cause early menopause. Actually, the family planning options protect the ovaries. Birth control pills have been shown to protect the ovaries from ovarian cancer. IUD, the one that goes inside the uterus, actually protects the uterus from uterine cancer. So, um, menopause is loss of estrogen.
Mm-hmm.
Is the byproduct of it is when the periods stop. When the estrogen has gone so much, you've lost 80% of it, then your periods stop. A lot of people think menopause is just stopping of periods. So loss of estrogen is the cause of menopause. And
Okay.
so things that can cause loss of estrogen, surgical, if somebody gets their ovaries removed, then their source of estrogen is gone. If
Okay.
somebody's on a medication that suppresses their ovaries, now birth control, family planning is giving you estrogen. So it's not taking away your estrogen. It's telling your ovaries not to make estrogen, but it's giving you estrogen. Some people are on medicines like steroids.
Hmm.
Maybe they have an inflammatory condition going on. People have chronic conditions that they're being treated for with very strong immune medications that can affect their ovaries. Or it's a family thing.
Okay.
There's some people that I had a patient in their family, they go into menopause early, or prolactin. There is a hormone from the brain that if it's too high, it can cause cessation of periods. It can quiet down the ovaries, but that one is reversible. That one you
Um,
just put the prolactin back down, the hormones wake up. So it's usually a medication thing, a surgical thing, or a hereditary thing that causes menopause,
early.
early menopause.
Thank you, doctor. I want us to just touch them sharp, 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 sharp. What could cause irregular ovulation and what can be done?
Irregular ovulation caused by different things. Thyroid, weight. A lot of people don't recognize that weight gain
Hmm.
affects periods.
Hmm.
Estrogen is also derived from our cholesterol level.
Mm-hmm.
So if you have excess cholesterol in your body and your body is converting that excess cholesterol to estrogen, it's going to act as birth control. So
Hmm.
here's what birth control does. Birth control pills have estrogen in them. If you are
Hmm.
taking birth control pills that have estrogen, the ovaries will see the estrogen and say, "Oh, we don't have to make estrogen. There's enough estrogen around." So the ovaries will keep quiet and they don't ovulate. So that's how they do birth control. They don't release an egg because you're taking estrogen. And so that's how those birth control pills cause no pregnancy.
Okay.
Now, if you're not taking birth control pills, but your body is seeing estrogen from somewhere else, which is your excess fat and excess cholesterol, the ovaries will act the same way. They'll keep quiet because they are seeing estrogen from somewhere else. So the people that are trying to get pregnant will come and say they're not ovulating, they're not releasing an egg every month. First thing I look at is what's her weight. Is she overweight? Is she making excess cholesterol? Or is she too thin? Is she not making enough cholesterol for estrogen production? So there
Mm.
are two spectrum of it. For the
Okay.
woman who's overweight, she can lose weight. For the woman who's underweight, we really have there's no gaining weight does not help the ovaries. We have to go to the ovaries, make them ovulate. So
Thank you.
biggest cause of irregular ovulation would be weight gain, a thyroid issue. Some people have low thyroid, high thyroid. It can
Wow.
dysregulate the ovary. So, like I said, when a woman comes for a wellness exam, I always check thyroid.
Okay.
Thyroid, prolactin, or from the brain. Some people make excess prolactin. It can suppress the ovaries.
Okay.
Number four, premature ovarian failure, early menopause. Biggest thing though that's very common is weight.
Okay. Okay.
Actually.
Okay. Thank you. Like I said, this other one, before you go to the doctor, is there any drug that can shrink fibroid?
Fibroid, there's no drug, but there's a surgery. I've been doing the surgery for 2 years now. It's a laser that allows me to go through the vagina. It's attached to an ultrasound. So in the operating room, I'm seeing the fibroid on ultrasound. I'm directing my laser towards the fibroid and I'm heating it up like as if I put it in the oven to heat it up to 200 degrees. And so
Okay.
it makes the fibroid from as hard as an orange to become mushy, like a marshmallow, like
Oh,
as if
yes.
it's
I
so it
saw.
reduces the volume, it reduces the pressure on the uterus, and it reduces their bleeding. There's no drug that can do that right now, but there's a surgery that can do that right now.
So if you shrink it, you still have to bring it out, or it's not necessary
No,
to
no,
bring
no.
it.
It doesn't disappear. It just becomes
Wow.
inactive. It just becomes inactive in there, and it can never grow back. Can never
Wow.
again because
Wow. That's
you've destroyed the DNA with that laser with the heat. You've like
okay.
separated all the molecules and made it irrelevant basically. So it will be there, but it's not active.
Okay, thank you, doctor. I don't think this question, the person should rephrase it. What, please, what causes cut during sex? I don't
I think
understand
she
that.
means bruising, bleeding,
Okay.
cuts.
Okay. Should be,
Dryness.
yes,
Dryness is the
yes.
number one cause of that. Dryness. So either lubricant, estrogen, or that laser.
And there is solution to it. That's why we brought doctor tonight. For all these issues, there are solutions to it. Please,
Absolutely.
let's seek for solution. Don't die in silence. Don't die in ignorance. That's where we are louder now. Let's talk about
Amen.
it. Thank you so much, doctor. Now, you said you have from the question sent earlier. Can I give you time to answer those, the one you are want
Yes,
to
ma.
answer?
What changes in my menstrual cycle are normal during perimenopause, and what changes might indicate a problem? I think that's a very profound question. They're saying that, as you get older, your periods change, and you're like, okay, is this perimenopause bleeding, or is this a bleeding that I need to be worried about? So most common symptom that people have in their 40s, it starts around their 45, 41, is that either they're having heavier periods, their bleeding is heavier,
Okay.
or their bleeding is lasting longer. It used to be 5 days, now it's 7 days, and they're passing blood
Mm,
clots
mm,
and things like that. Or they're skipping months. They
mm,
skip 2, 3 months, and then when it comes, it's heavy. Now, any abnormal bleeding in a woman over 45, any abnormal bleeding, meaning the bleeding is heavy, she feels like she's hemorrhaging, she's changing her pad almost every 2 hours, or if she uses tampons, she's changing the tampon every hour. Prolonged bleeding, meaning is lasting longer than 7 days. Um, or bleeding that lands some people in the emergency and they're needing to do a blood transfusion
mm,
should be investigated
mm.
because perimenopause bleeding is a diagnosis of exclusion. After I've excluded everything else, then I'll now say, okay, you are most likely having perimenopause bleeding. So women who are in perimenopause still having monthly cycles. Now, perimenopause is around menopause, meaning
Yeah.
you're not yet in menopause, but you're around it and you're having some symptoms of it.
Mm.
So if you're having a monthly cycle lasting 4 or 5 days
Mm-hmm.
and your period is not controlling your life, that's fine.
Okay.
Any type of bleeding outside of that, meaning it's heavy, it's lasting longer than 7 days, you're passing blood clots, you're needing blood transfusion, or now during your period you're eating ice.
Mm.
Oh, they are craving ice so much, they'll have a big jug of ice. They are losing too much blood, they're now anemic. Or
Mm.
some people crave weird things like tissue paper.
Wow.
It's a sign of iron deficiency. You're losing too much blood during your period. That's abnormal bleeding. And if you're 45 and above, around that 40s, we do ultrasound. we do biopsy, and then as long as everything is negative, we say, okay, it's perimenopausal bleeding. What do you want us to do about it? We can do a DNC, we can put you on hormones, we can remove the uterus, we can do different things to help you manage that bleeding during that period of time. But anything outside your normal 5, 6, 7 days of period is considered abnormal. So
Wow.
perimenopausal bleeding is a diagnosis of exclusion after you've excluded all the bad stuff, uterine
Mm,
cancer, uterine polyps, or even sometimes ovarian tumors can cause abnormal bleeding.
okay.
Uh, Thyroid problems. After we've excluded all that is when we now settle down and say, okay, it's perimenopause. What do you want to do about it?
Thank you so much. Do you still have a, because I have a question here.
Yes.
Look at this. What are the causes of ovarian cyst and endometriosis? What is the best treatment? Maybe in 1 or 2 minutes,
Okay.
doctor.
Yes, ma. Now, ovarian cyst, people think ovarian cyst is a bad thing. We actually make it, every woman who's having a period is making a cyst every month.
Hmm.
Whenever you are ovulating, you grow an egg. You grow an egg in the cyst. The egg is microscopic. We cannot see it with our eyes. The only thing we see with our eyes on ultrasound is the cyst. It's called a simple cyst or an ovulation cyst. You need to make a cyst every month for you to ovulate. When you ovulate and the egg does not get fertilized, you have a period. When you have the period, the cyst goes away. You make another cyst the next month. So
Hmm.
causes of ovarian cyst is ovulation. Releasing an egg from your ovary requires you to make a cyst. Now, let's say the cyst has bleeding. Let's say then it becomes a complex cyst because now it has blood in it.
Okay.
Let's say the cyst has it's an abnormal cyst called a dermoid cyst. Then those types of cysts will not go away. They'll be persistent. They might grow bigger every month
All
or
right.
stuff like that. So anything outside of a simple cyst is called a complex cyst, and that one usually causes pain, problems, and we have to remove them. Endometriosis, we still don't know what causes endometriosis. We just know that there are some women who have severe pain with their periods, meaning debilitating pain. They cannot go to work, they cannot go to school. They're taking so many pain medications with their periods. We think it is backflow from menstrual blood, but that doesn't explain it because every woman has backflow from menstrual blood. So why will some women have endometriosis and some will not? Now, endometriosis is an inflammation condition. The pelvis is inflamed. It gets worse during their periods. Severe pain, even sometimes when they have a bowel movement. Severe pain during intercourse. People have pain with sex, can be due to endometriosis. Treatment for endometriosis, we try to suppress your estrogen. So there are different medicines around now that will suppress your estrogen. Maybe if you reduce your estrogen to only 40% production. Side effects of that is menopause symptoms. So those women. Second option is to do birth control continuously. The birth control, like I said earlier, suppresses your ovaries. So
Okay.
continuous birth control will suppress the inflammation from the periods and will still give you the estrogen and progesterone that you need for your life. The third option would be surgery. We go in,
Okay.
I see the endometriosis, try to remove as much as possible. Some people it works, some people it comes right back after the next period.
Okay.
So it's a
Oh,
chronic condition that can be quite difficult to treat, but there are treatment options for it.
thank you, doctor. Time is just going fast, fast, fast. And I have few things there. Do you still have any one of those questions you want to answer? Because I have few things I want to ask before
Yes,
the time click. Do you have anyone from your end? Because I have about few ones I still want to ask you here.
yeah, I think I addressed the ones that are in here already in the conversations that we
Okay,
had. What is
okay,
the essence of a mammogram? How
okay.
often should a woman get a pap smear done?
Okay,
Pap
you've
smear is
answered them.
21 and up, and they should do it every 2 to 3 years.
Okay. What causes very painful menstruation? Is it? Is that
Different things, different things. It could be endometriosis, like we talked about.
okay?
It could be fibroids.
Okay.
Fibroids, the uterus is trying to squeeze blood out, and if there's a tumor inside the uterus is squeezing against the tumor, can cause more pain. So we have to find out when the pain starts, what kind of pain is it, and do some ultrasounds to find out what's causing the pain. But that's a very broad question. It could be many, many different things.
Okay, like this question I was even about to ask. It said, why do fibroid go back after undergoing
Undergoing
surgery?
surgery. So that type of surgery is called myomectomy, meaning Myoma is fibroidectomy, means removal, just like hysterectomy. Hyst is
Okay.
uterus, ectomy is removal. So
Oh,
hysterectomy is removal of uterus, myomectomy is removal of a fibroid.
all
Now,
right.
during a myomectomy, I do myomectomy for women who have pain, and there's so much, it's very big, it's pushing on their pelvis. They are peeing every 5 minutes. That's like the fibroid is pushing on their bladder. So there's some, or women who want to have children, and we need to remove that space. We need to remove that volume that the fibroid is taking up inside their uterus. But what we're doing during the myomectomy is we're removing a fully grown fibroid.
Hmm.
When we remove it, there are microscopic cells that are left behind. There's no way for us to see it. So
Hmm.
after a few years, those microscopic cells start to reconstitute again and grow
That,
back. So when
wow.
a woman chooses a myomectomy, I always tell her, okay, there's a risk that it might grow back in 3 to 5 years. If you want to have children, you have to have children a year after a year after the removal, so that you have full use of your uterus before the fibroids start to grow back. Or a
Mm-hmm.
woman, maybe she's in her 48, we think in the next 5 years she'll be in menopause. Even if it grows back, it's not going to cause a problem. So those are women that I offer myomectomy to. Most women, if they're good candidates, I would tell them, let's shrink the fibroid because it
Okay.
destroys it and does
Okay.
not allow it to grow back. But
Okay.
sometimes there are some fibers that can't be shrunk. If they are 14 centimeters, it's too big.
Oh, okay.
We have to remove it.
Okay.
But so
Mm.
the reason it grows back is because we are removing a fully grown mature fibroid. The
Okay.
little cells, microscopic cells that we cannot see that are left behind, have the potential to get back together and grow again over the next 3 to 5 years.
Thank you so much, doctor. Somebody is asking question about bone scan, but we've answered that. Please watch this video again. Doctor has answered that. Our time is fast spent. Now, okay, there is this few ones I want to ask you, doctor, before you go. We have few minutes. It's like we should be here for the next one now. For those of us that are very conservative, I would say that I think I've discussed that with you before about HRT, hormonal
Yeah.
replacement therapy.
Yeah.
What advice will you give? And some of us are suffering from symptoms of
Hmm.
menopause, and yet we don't want to take hormonal replacement therapy.
Hormones.
What do we
Yeah.
do, doctor?
That's a fantastic question. And I do encounter patients like that in my office as well. So it depends on the profile of symptoms. What symptoms are you going through? If you are
Mm,
going through hot flashes, sweating, sleep problems, mood irritability, there are non-hormone medicines we can give you. One of them is like a low dose antidepressant, and it can take the hot flashes away and help you also manage your mood and also help you sleep better.
mm,
If we are dealing with symptoms that are purely hormonal, like low sex drive, low energy, low motivation,
mm,
tiredness, fatigue,
mm,
then those women, they can try to get testosterone. Testosterone is the treatment for that. But let's say they don't want testosterone. They can try to get testosterone naturally. People use things like maca root.
okay.
I have patients who come to me saying maca root, ashwagandha. These are like herbs from plants that have testosterone derivative that they can get some of it from. Now, you might have to take a lot of it. You might have to take it every single day
Mm,
to get the same effect as if you got testosterone directly. But for some people, it helps them. Some people, it's lifestyle. It's,
mm,
exercising every day. I have a patient who says she does not miss her exercise every day because if she misses it, her hot flashes are out of this world. So
mm,
exercising every day, drinking a lot of water, watching her diet, knowing her triggers. So
okay.
if the trigger for hot flashes is hot food, spicy food, alcohol, sugar,
Mm-hmm,
people
mm-hmm.
sugar, people caffeine. If they drink anything that has caffeine in it, they get a hot flash. So avoiding your triggers can help you manage your hot flashes. But if your symptoms are not hot flashes, sweating, sleep, but it's focus, concentration, my best is testosterone. That's the
Oh, thank you so much, doctor. For those who joined us late, apart from all these hormones, giving us this hormones therapy, there's also need at times to go for counseling, like you earlier said. Because if you are taking hormones and there are other factors
yeah,
affecting you, it might not work.
yeah.
So there are times that you need to go for further counseling apart from taking hormones. Now, There's I'm thinking, can I, will you be able to say one or two things on this before we release you, doctor? Please, can you help me appreciate doctor in the chat, because we are rounding up now, our time is up. And then somebody is asking for doctor's contact. Please check this video, the description section there. The website is there, media, the handles is there, Instagram, Facebook, website. Please, you see so many videos. I was watching the one you did about miscarriages, just 4 minute
Mm,
video, and it's very, very, very informative for those
thank
who
you.
have experienced miscarriage. So please check our website, subscribe to our YouTube channel. This is free consultation, but after this session you are going to pay. So go and
Yes, it's
subscribe to
private
the
practice.
channel, and then there are free videos that you can learn from all the videos you put on
Mm.
YouTube and Instagram. They bless me, even on LinkedIn. They bless me a lot. So many videos on that. Now I don't want to be, because it's like most of my questions on menopause, because I'm in that category. There are people that who have not reached menopause. I just want one or two things. What will you? I just want something for them too, the younger ones who have not reached menopause, because I don't want us to just concentrate on young
Yeah.
people. Okay.
So for younger people, the biggest thing we end up talking about is their periods and preparing for pregnancy. So
Okay.
a lot of people, I have some people that will come to me, they're in their early 40s and
Mm.
they haven't had children and they haven't made plans for children. Now, as women age, eggs decline in the ovaries.
Mm-hmm.
So pregnancy becomes harder as a woman gets older. So I have somebody I was looking at on my Facebook. Somebody was saying, "Oh, she's not even going to think about pregnancy until she's 38." So I was trying to tell people that, hey, eggs begin to decline faster at the
Mm.
age 35 and up.
That's
So if you are in your 30s, 35, 37, it's time to have a conversation with your doctor about, okay, I'm not married yet. I don't have plans for children yet. What can I do about preserving fertility? So that's a big conversation. Now, will insurance cover it? Is it cover? It might be a costly thing to try to freeze your eggs. But if you have access to it, is one thing I tell my patients to do. It preserves your eggs let's say you're 34. Let's say you don't get married until you're in your 40s. You're not trying to be using 40-year-old eggs. You have your 34-year-old eggs that you can use to achieve healthy pregnancies. Not just eggs decline, they also become older eggs. So increased risk of miscarriages when women are trying to have kids in their 40s, increased risk of Down syndrome, genetically impaired pregnancies. So I always tell my young patients, make sure that if you're getting up there older than 35, but you are not in a relationship, you're not planning pregnancy, make sure you're putting plans in place for that, or at least starting to have the conversation with your physician about pregnancy.
doctor. This one that you gave us last is the icing on the cake, which I will emphasize again before you go.
Yes.
You are about 35, you are not married, or you have a daughter, a sister who is 35. Did you hear the doctor? See, technology has gone far.
Yes.
It's good to wait for the right partner, but there are things you can do. You
Yes.
can preserve your egg. I'm sure some of us Africans are, and we are not talking about this world. You can
Mm,
preserve your egg, because if you now eventually get married, maybe at 40, 45, you have done something. You have
something.
preserved your egg, because
Yeah.
by then it get difficult, except by
Oh,
mercy of God.
yeah.
So if you are young and you notice that time is going, you are 35 and above, you can preserve your egg. Did you hear that? I'm saying this now because I know so many people don't have that knowledge.
Yeah.
These are the things we are just hearing now. It doesn't mean that you should go and rush into marriage because you want to have your children, but you
Exactly.
know, technology has made things so easy now. I heard of a case of a woman who has frozen her egg about 13, 14 years before, when she was looking for children. She has even given up. It was when she spoke to a fertility doctor. We have brought the doctor to this platform before, Dr. Sharon, and she was sharing the testimony that after 13, 14 years, she has given up. She was even trying to think about surrogacy. And the woman was saying, when you were doing all those fertility, did you present? I said yes, but years ago. They called the hospital in Europe, I can't remember the country, and they said yes, that she
Yeah.
only need to pay for a few years that she has stopped paying, because you have to pay
Yeah.
for
Pay
preservation.
to pray for preservation. Yeah.
I'm telling you, the baby is alive now. 13 years egg frozen. So knowledge is power. The Lord will help us. I think
Absolutely.
we are done. See other questions. Connect
Yeah,
to.
there was a question here ma, about somebody over 70 who is peeing often. Like I said before, there are different, it could be the diet thing, is there caffeine in your diet? It could be most times loss of estrogen in the bladder. It could also be medications. Some blood pressure medications make people pee all the time. So that would be try, process of eliminating those things that are inside your
Okay.
profile that can cause that. But thank you so much. This was fun. I always enjoy coming here.
Thank you so much. Please check doctor's website and Instagram handle on our page, and share this video. If you've been blessed by all the information that doctor gave to us, please share it and connect to her. Her email, everything is there. Thank you so much, doctor. We can't
Thank
thank
you.
you enough. We appreciate you.
Thank you
God
so much.
bless you. Please
Thank
help me appreciate doctor in the chat while we
you.
release her now. Thank you very much. God bless you.
Thank
We are
you.
5 minutes over 1 hour. Thank you so much, doctor.
Thank you, ma.
We'll be seeing you next year by the
By
grace of
God's
God.
grace. Amen.
Thank
Thank you.
you. We love you, darling. Thank you
Thank you,
so
ma.
much. Thank you. Thank you. Oh, my people, are you not blessed tonight? I'm full. Honestly, I'm full. I'm blessed. Dr. Taiwo is always, each time we had a session, it's like, oh, she should not go. Thank God. Please share this video if you have been blessed. See all the information she gave to us there. Please don't keep it to yourself. Don't keep it to yourself. It's not about building channel. It's about sharing this information. Knowledge is power and knowledge is golden. Why ignorance is an affliction, is a disease. So many things we suffer from, and people perish because of lack of knowledge. Even in the course of our saying we have our faith, there are things that we need to know. The Bible says knowledge will increase in the end time. Knowledge is increasing, and we need to make use of those knowledge, even as Christians. God help us in Jesus' name. Thank you very much for connecting us tonight. Connect our this YouTube. If you have not subscribed, please subscribe. Share the videos, and if you check my YouTube channel, we have almost 100 videos there on different areas of family life, both health, marriage, family. Check them; they will bless you. Thank you so much for connecting us tonight. God bless you all. We appreciate everyone. Thank you.